It's now my great privilege and pleasure to introduce our next speaker, Dr. Fiona Adshead, who is currently chair of the Sustainable Healthcare Coalition, and that's a coalition that inspires partnerships and action on sustainable healthcare. So Fiona brings an enormous wealth of experience to her current role. Her CV will take you quite a while to read, and it's very inspiring. But basically, the wealth of experience comes from a huge range of roles that she's held, but including from previous roles such as Deputy Chief Medical Officer for England and a Director at the World Health Organization. And Fiona is going to talk to us about the power of partnership in and designing sustainable healthcare. So you're very welcome, Fiona, and over to you.
Thanks very much. And just checking, can you see my presentation okay?
Yes, thank you.
That's fantastic, and it's lovely to follow Rachel, and fantastic to hear about smoking cessation. One of the things that I was involved in when I was Deputy Chief Medical Officer was, overseeing and bringing in smoke-free public places, and smoking cessation has a particular place in my heart. And during that time, I got interested in the work that was beginning to happen in the then Labour government around sustainability and what they were planning to do. And it really struck me at the time that we needed to connect in health, and that environment and health weren't connected. And I think that if there is anything in the last year that has proved just how important these two things are, it's sadly the pandemic and the huge changes we've all been going through. I think this cartoon very neatly describes the fact that these great waves of change have all been interconnected, and that we know that people during this time have really valued nature, and they found great solace in that. But clearly nature and health and our environment are very much connected. We have only one planet, our home. And I think these interconnected reasons for urgent action are now top of the agenda. I mean, in the last few days, it's been difficult to escape the news of COP26. But of course, the movement for change on this has been going on for a long time, with the Lancet and others and the World Health Organization really championing the connections between health and climate change. And it's now really got to a crescendo, because as I mentioned, obviously people have begun to realize that the connection between biodiversity loss and the emergence of new zoonotic diseases are really connected, and that of course we live in an interconnected system. But what does health mean in a changing environment? Well, Rachel mentioned the really important subject of air pollution, and thankfully now this is also much higher on people's agendas. The World Health Organization again has championed this for years, but we know that globally probably at least 7 million people a year die from air pollution, and that it affects so many different parts of our physiology. And increasingly, as the evidence comes in, we realize just how far-reaching that is. But I think one of the reasons perhaps why we haven't acted in the past is the sense that maybe it's just too difficult. But I think again last year just showed what the difference is when we do have rapid societal change, and that in fact change is possible. And whilst we saw in cities that they became cleaner, there was less air pollution, and British Lung Foundation and us in the UK showed very clearly that people's reporting of symptoms was much less. There has also been a bigger movement through things like the Clean Cooking Alliance in low and middle income countries, but also through supply chains to move to cleaner forms of transport to reduce impact. And that campaign and the need to really change air pollution is, if you like, an example today of what our imbalance between our health and our environment is all about. But one of the concepts that's really central to health and climate change is this notion that what is good for your health is also good for the planet. And this is quite a complex diagram that the BMJ published a few years ago, which really shows the interconnected nature of health and the environment. That, as I mentioned, for example, improving energy so it becomes renewable and cleaner also improves our air quality, and that in turn improves our health. Likewise, exercising improves our health and improves air quality at the same time. And this notion of co-benefit is central to a lot of the work that's gone on health and climate change. And so when you look at these co-benefits, you can see that moving towards active transport can improve a whole range of diseases, from cancer to dementia to heart disease and stroke. And obviously, in its own way, therefore saves money for the healthcare system. And we know that this is absolutely about how we design our environments too, and that cities often have urban heat islands, and that actually introducing nature can not only give people walkable spaces, but can also reduce some of that inner city heat trapping. And so there are a whole range of reasons in which we can begin to imagine how the world might be different if we built, for example, nature in, physical activity in, and how that would benefit not only our health care and our health, but also more broadly planet. So I'm going to stop sharing at this point and allow you to do a poll, really to find out what your experience of this subject around air quality is in your own practice. It would be really great to find out on Slido. That's great. So I think that over half of you have found some impact on your practice and what your patients are concerned about reporting to you. So that's really interesting and obviously mirrors the evidence of what we know. I will start reloading my slides again. So air quality and environment impacts, and it's interesting to hear it also impacts in your own practice. But within the healthcare sector, what are the impact and opportunities for action? Well, many of you may already be engaged in this, but I just wanted to give a summary of, what's been happening. Overall, there is a global movement on this. Healthcare Without Harm, a global organisation, has been working with UNDP and others to really bring to the fore what impact climate change is having on health. And overall, they found, just as true in our country, that over 4% of our global emissions of carbon dioxide are actually related to healthcare. So whilst at the same time we're improving people's health, we also have an impact. And there's an opportunity for us to think about our own practice within the healthcare system. And if you looked at healthcare across the world, it would actually be the equivalent of the 5th largest planetary emitter. So that's big. And a lot of it relates to the energy we use, the transport we use, but not surprisingly also the products and services that we use within the healthcare system. So a year ago, I'm sure you will have heard of this, but there was the launch of a net zero national health service where, as a system, we committed to becoming, at the time, the most sustainable healthcare system in the world by 2040. And a year on, huge progress has been made, and it's the equivalent, if you like, in terms of the reduction of carbon dioxide, which often is really difficult to get your head around because it's such an abstract figure. It's equivalent to the electricity needed to power over 1 million homes nationally. But at the heart of this, and what I want to go on to talk about, is some of the work that we've been doing in the Sustainable Healthcare Coalition, is what we buy in the health service and what we use. And quite a large proportion of the carbon footprint of the healthcare system is medicines, equipment and other things in the supply chain. And about a quarter of the emissions overall are related to medicines. And each of these areas give a big opportunity for change. What I wanted then to ask is another question of you to really find out, what proportion of you actually think about environment when you start prescribing. So I'm just going to stop sharing, and then the Slido poll will go up. So that's interesting. It's about even pegging in terms of who does and doesn't. And actually, it's really interesting that you as a group are very encouraging. I gave a talk about a year ago to a similar group, and there it was much smaller. So interesting to see that this is part of your thinking today. So I'm going to start resharing my slides again. I hope you can see my slides now. So what are the opportunities then to really accelerate action and really think about environment as part of prescribing? Of course, it's complex, and all of this has to be, as we were hearing before, patient-centred. But if we look overall, as I mentioned, medicines are about 25% of the overall carbon footprint of the NHS. And of those, inhalers are 3% of the overall footprint. So that's large. And as we know, there's been a big drive recently to reduce waste, but there's also been increasing emphasis placed on thinking about the environmental impact as part of inhaler use and prescription. Because, as you probably know, multi-dose MDIs actually have propellants which have harmful greenhouse gases, and whilst many companies are reformulating the propellants they use, they are still quite environmentally damaging. So that it was recently described that one inhaler is about the equivalent of driving 200 miles in your own car. So that's quite a lot, and there's now a big move not only to shift towards dry powder or soft mist, but also to really think about, as you know, improving quality of care around steroid prescriptions and all the things that are part of your everyday practice. And as well as thinking that's good and providing the kind of guidance, there's also now a move to incentivise it through the pharmacy quality scheme, particularly around returning inhalers. And there's a campaign that's been launched in the last few months looking at returning inhalers to pharmacies so that the harmful greenhouse gases can be incinerated at high temperatures. But also in primary care networks, thinking about reducing meter dose inhalers so that they become less of the predominant prescription, because in Europe about a quarter of patients receive it, whereas here it's the opposite. So a big shift to incentivise the system. But of course, a number of groups have been looking at this, and the Primary Care Respiratory Society looked last year at greener healthcare, and it made the very important point that you have to think about care across the system, and that, as you well know in your everyday practice, it's all of these factors from prevention through to how you diagnose to how you support patients on that care pathway that are important, and whether or not they can use things like digital services. All of those things are important. So, as you were hearing before from Rachel, that leadership from health really matters, because if you look at who the most trusted professions are, and I think the most recent survey in fact showed that nurses now are the most trusted profession, it's really important that as clinicians and practitioners, we promote greener healthcare, because people will trust us, and that we need to obviously get that in a personalised care setting that really works for people at the same time. So it's very much an opportunity for action. Over the coming week, you'll be hearing more and hopefully in the news about climate and health. It's the first time for a COP summit that there has actually been health as one of the scientific themes, which is great. And that's beginning to bring together those environment and health themes. So what we know is that health and environment are connected, and there's now a huge movement and a really rapid acceleration within the system for bringing together health and environment. But what I wanted to talk to you about now is some of what we've been doing in the Sustainable Healthcare Coalition. At the end of it, we know that the most important thing is working across the system. And recently, at their anniversary, the NHS produced its roadmap for suppliers. And what we've been doing as a coalition is working with the Greener NHS team to really think about how suppliers can shift their practice. And the roadmap really lays out how products need to change, and that was a big declaration a year ago saying that no suppliers of the NHS could be suppliers unless they were net zero. So a big move to shift. And we were formed actually by the NHS about 9 years ago now, because when they first did their work looking at the carbon footprint, they realised that suppliers were so important, and they wanted to bring together companies to really help them work out what the carbon footprint was. So what we did was we actually worked together to come up with how you could carbon footprint medicines and devices. So really at the basis of some of that guidance that's now available that shows you how to carbon footprint each of the inhalers, that was the first move to really get this into a standardized format. But we then moved on to realise that, as I said, that care doesn't just happen in a device or an inhaler. It needs to be taken into consideration across the whole healthcare pathway. So we produced Care Pathways Guidance, which breaks it down into the different elements that you'd recognise. So GP consultation, patient travel, outpatient, and all those sort of things. And we've now put that online in a carbon calculator, which allows you to do what if scenarios for your own pathway of care to look for opportunities for change. We've then taken that guidance and applied it to our own members, because it's no point telling other people what to do, you've got to do it yourself. And we've looked at, for example, in respiratory care, how smart inhalers can help better adherence by, for example, giving an app that enables parents to help with the care of their children. Or we've looked in other areas like reusable inhalers, or in other areas like surgery, how digital can help people go on a care pathway, or in fact in renal care, how you can redesign a pathway to have less impact by reducing water and electricity. We've got very interested though in the element of carbon in low carbon clinical trials, because it was brought to our attention that the Sustainable Clinical Trials Group over a decade ago really pointed out that the emissions from clinical trials were huge, and that they really totted up to about a third of the emissions of a country such as Bangladesh. And a few months ago, in partnership with others, we produced an editorial in The Lancet, and we're now beginning to do a piece of work funded by the NIHR to really look at developing an eco-design tool. What do I mean by that? Well, really, it is something that would enable you to do what-if scenarios to design your clinical trial to have less emissions. And that would include, for example, working out what your clinical trial its impact might be in advance, but also looking at the impact of completed trials, and then using this information, very importantly, to give companies some of the data that they don't have at the moment around their carbon footprint, because of course if you can't measure it, you can't manage it. We've also been working with academic health sciences networks, and we worked with the Oxford one on some testing for preeclampsia, PIGF testing, which really enabled women to be identified much more accurately who was going to go on to develop preeclampsia. And the case study that we did with them really showed that for the NHS as a whole, you could save about £4 million, but that also contributed to about 3 million miles driven in a car. So that's huge. And I think what we found consistently throughout all our case studies is that things that improve people's health also reduce environmental impact and reduce cost. So it's a pretty important finding. In terms of how we work with clinicians, some work we've been doing in the last year is with the lead hemodialysis consultant in Newcastle, Surin, around his care pathway and really breaking it down to those elements that I talked about. Not surprisingly, we found that medicines are a huge part of that footprint. Patient travel is really important. And we've worked out with him where the opportunities for change might be. And we'll be going on to look at other areas of the care pathways, such as home peritoneal dialysis. And we're working with the UK Kidney Association to really look at how we can champion change. And for the NHS at the moment, renal surfaces actually are quite a big impact, but we will be pushing forward what we've done so that we can contribute to maybe where the next focus will be. So I've talked a lot about what we've done. I think as we look forwards, there's going to be a huge shift. I mean, picking up on Rachel's theme, patient-centred care pathways and personalised care are absolutely going to be where there are huge opportunities to reduce environmental impact, as obviously is digital and artificial intelligence. What we've also found is that so many health practitioners are really demanding change, and it's been fantastic to work with the UK Alliance on Health and Climate Change and a number of rural colleges to look at the opportunities to think about new materials, but very importantly for our own companies to really say in the supply chain that they need to be able to demonstrate what their impact is and that the change needs to be accelerated. But we're also beginning to look at new areas such as circular economy, where you're reusing materials, but also the impact, as I mentioned, of biodiversity and, for example, offsetting with forests. So, I mean, I guess what we've learned through this kind of partnership is that if you can bring people together and openly talk about the challenges you face, then you can forge a very good common purpose and get change. That really by working with clinicians in delivery settings, we've really got new perspectives and it's opened up possibilities for change. It's given us huge energy for innovation. And I think part of this is really about reimagining the system rules about what quality is, so that it's not only based on great clinical outcomes, but it's also based on reducing environmental impact as well as cost. And a lot of what we've been doing, as you gathered, is really trying to measure that impact and look for new opportunities for partnerships. So to kind of summarise, we've worked a lot with the NHS around supply chain and procurement. We're working now on how we can design tools for low carbon clinical trials. We've been working with organisations like IPAC and others around the inhaler reuse and return schemes. We're going to be continuing to look at detailed care pathways, renal, but we're always open to new opportunities for collaboration. And we're very interested about how innovations such as the example by Oxford can really lead to the use of prevention. And later this month, we're going to be launching a primary care calculator for practices with Matt Sawyer, a GP, who's been developing this to really think about that carbon footprint and how that contributes to ICS green plans. And then over coming days, we're going to be working with colleagues on Race to Zero, which is one of the big collaborations across the pharma industry at COP26, but also beyond that with Healthcare Without Harm and other colleagues. So that was really all I wanted to say. You know, we're always open to new collaborations and new ways of looking at how we can make healthcare more sustainable. And thank you very much for inviting us to talk to you today. And I look forward to getting some questions.
Thank you very much indeed, Fiona. That was excellent. And obviously it's an enormous topic, and starting from a place where it wasn't considered to now getting it front page news to consider the environment, I think is quite an achievement. So we have a couple of questions already in the chat. One is around e-cigarettes, and I think we're going to see if we can first of all get a Slido poll on that before we come to a question. But Kiri Mosley from Kent Community is asking if there are any initiatives in particular around reducing plastic waste, considered given the enormous increase in the use of PPE in the pandemic. And I think I saw a quote the other day of a nurse saying that she does everything in her personal life to reduce her carbon footprint and gets through about 50 plastic aprons a day. Have you got any comments on that?
Well, I think, you know, one of the big challenges in the pandemic has been about single use. There has been some really great work. Chantal Rizan, who's been working with the Royal College of Surgeons and is based out of Brighton Medical School, has done some specific work on this. You might have heard her actually recently on Radio 4 talking about reusable masks, for example. So I think, you know, obviously in the pandemic, most of the things that we want to do, you know, needs must. But increasingly, people are now looking at ways to reduce the impact. In terms of single-use plastics, absolutely. The NHS itself has focused a lot on catering and single-use plastics, as you're probably all aware. And we have worked with our members to really look at what are the opportunities for reducing plastic. That's one of the reasons why something like a reusable inhaler is important, so that you're not just throwing away something that in fact you could reload. So there is a lot of emphasis on that. And, you know, I think a lot of it comes back again to waste as well. So it's thinking across that system around how you can reduce waste, but also what are the opportunities to design out plastic that we don't need, you know, balancing that against safety.
Thank you. And you've talked a lot, Fiona, about collaborating and about needing to work with clinicians. So how do you reach out as a coalition to, you know, clinicians? Obviously, you're talking to our group today, but there might be individual clinicians who might want to pilot something. How does the collaboration work in practice?
Well, we're always, I mean, we literally are always open to people reaching out. Surin and all the work we've done in Newcastle came out of something similar to this, where, you know, his thoughts were triggered about, you know, could we work together? And our group were very interested in that collaboration. We're currently talking to the lead for emergency medicine about opportunities to collaborate. So it's literally, as these things often work, about people approaching us, and then we work out with others how we collaborate. The clinical trials, together with the UK Health and Climate Alliance, we've pulled together this group and bid for funding, and that was how that collaboration came about. So we're always open to thinking about new ways of working with people.
Great, thank you. And I know there has been a bit of discussion in the chat around e-cigarettes. So team, are we ready with a Slido poll on this? Jo?
Yeah, we can do that. Okay, but we're doing it. I was going to ask Paul if you wanted to sort of verbally ask the question or give a view.
Thanks, Jo. No, it's just I've been hearing and following it on the news, and I just, you know, I was interested in particularly Rachel and Fiona's view on it, but the rest of the group as well. I mean, I share Vicky's response. I'm horrified by the idea of prescribing e-cigarettes. Looks like that's what the Slido confirms as well. I'll just add my no. So that sort of reassures me.
Yeah, I think they're still coming in. And Vicky, do you want to say anything?
Yeah, sorry, I can't get my camera to work, so I apologise for that. I appear to be offline for that. But
yeah, you from the old days when we all used to meet.
Yes, I know, I missed that. I'm sorry, I know that was to the general group when Paul put it, but I am so horrified. I'm almost speechless whenever I read about it happening, because we really don't know, and particularly with the evidence that we're seeing more looking at all the studies that I'm reading, that more young people are also considering vaping without having actually addressed smoking at all as an alternative, as a community participation. And there appears to be evidence from some American studies that increases their risk of developing asthma. I just feel that the legalization, so to speak, of using them on a prescription kind of gives it the okay that it's safe and sends out the wrong message. And I think that's the background to my very strong response.
Thank you. Thanks, Vicky.
I think the UK's got a bit of an outlier in this approach as well, and it always had much higher use. I don't know, Fiona, have you got any comments? Thanks for that Slido show. I think that's pretty clear.
I totally understand people's concerns. No, I don't. And I have been interested, I guess, in how the debate has evolved. Obviously, you know, with people trying to balance the evidence of e-cigarettes against that broader concern about it mirroring behaviour and encouraging maybe an entrance into smoking itself and all the side effects that your colleague just highlighted. But no, I don't have a personal view, but I can totally understand people's concerns for the reasons that were just expressed.
And on the topic of hot debate about prescribing, Fiona, there's quite a bit of debate around switching patients from metered dose inhalers to dry powder inhalers, and there are those who are, you know, for it because of the greenhouse gases, but the argument against is that DPIs have a lot of plastic in them, for one thing, and the environmental difference is one question, but the other question that people are coming up with is that it should be personalized care, and therefore it should be the right inhaler for the patient. And so there's two questions in there, really. One is about the environmental impact of the two kinds, and the other one is about your views on the prescribing because of that.
Yeah, well, I guess on the first one, the manufacturers who still produce inhalers with propellants which are very high impact are redesigning them, so they will change. How much they will change remains to be seen. So I guess there might be some opportunity to change MDIs themselves. I guess, you know, I think that everybody is emphasising the fact that this absolutely needs to be about personalised care, as you said, and everybody needs to go on a journey. I suppose what I'm curious about is that in Europe, the opposite is true, in the sense that patients have been more likely to be put on DPIs than MDIs. And obviously, I don't think people, you know, patients in Europe are so very different. So I guess it's possible for asthma and other respiratory conditions to be controlled using a different mix of inhalers, but going on that personalized journey, you know, making sure that prescribing is done in patients' best interest is absolutely central to this. And I know that, you know, it will always be true that patient outcomes and personalized care come before environmental impact. And I think, though, it's about routinely being asked. I mean, I'm asthmatic myself, and when I went for my review by my local practice, it was me asking them about the impact of my, you know, inhaler. I think it's just something that we need to have as part of that conversation. And then, you know, there is a lot of materials on Prescript for patients, giving them, you know, information, as there is on the NICE website. So this has to be done in a personalised way. And I think it's also possible in the longer term for us to go on a journey of change.
Thank you very much. And Joe, your hand is up.
Yeah, thanks. So, I mean, we've been on this journey once, haven't we, from the CFCs? So I think you're right. Manufacturers will change. What I want to ask you, if you know, and I'd be interested in other people's views as well, is how robust the global warming potential data are around inhalers. So that's what I've looked at. Is that a good thing to look at? Is you know, how robust that data is from your point of view?
By robust, I mean, what? Just explain a bit more, Joe, about your concern on it.
Well, it's so the methodology to produce that figure is just beyond my kind of ken. I just wouldn't be able to start. So the reliant on data that comes from other sources, and clearly the people that make those inhalers, their business is about making a profit. It's in their interest to, you know, have low global warming potential. So I just don't understand the process and how we can trust it.
Yeah, no, well, I think it's a really good question. And that's why when I was talking about supply chains, it's so important that they're externally valid, you know, verified and validated, because, you know, you can't just take assumptions. a lot of the carbon footprints, and it's actually why we produced our carbon footprint guidance in the first place, is actually verified against the greenhouse gas protocols. So the kind of gases that are in inhalers have been assessed and have been included in those standards and guidelines. So the metrics are robust, but that is precisely why it needs to be verified, and it needs to be done against those standards that everybody recognises. I think in my experience, the main manufacturers of MDIs are open about the impact they've got. I think in the end, we can get into arguments about spurious precision. What we need to do is get change, really, and get rid of propellants, you know, whether they are perhaps a few times more impactful than is said is probably less important than getting them redesigned and taken out. But there are standards, so I think we can be confident, and that's why also, though, we need to retain the need to verify and make sure that what we're being told is true.
Thanks.
And Joe, you popped a question in the chat. Do you want to ask it?
Just got someone drilling outside. It always happens to me. Yeah, I would imagine that, and maybe people could sort of contribute, but that people sitting in there thinking about their teams might be interested in thinking, what could our respiratory team in hospital X or community or in an integrated care system on a small, what could we do? What would you advise them to? How do you advise them to get started?
Well, the Greener NHS team has got some really good guidance around how staff in the NHS can get engaged, which, you know, includes everything from thinking about your own carbon footprint, thinking through to your practice. I think the Primary Care Respiratory Society's approach is useful, and that's looked across the system. So I think that's a good resource document. And I think that it's largely does focus down on inhalers and things like Prescript, NICE, others. You know, there is a lot of material to start with. So I think, you know, it starts with you as a person in your own life, you working in the NHS as a champion for greener healthcare, and then really thinking around that prescribing care pathway, as well as, you know, thinking around, you know, remote outpatient appointments, as well as seeing people face to face, because travel's another factor. So whilst, you know, there's been some controversy around primary care and face to face appointments and all the things that we know, actually getting that balance right, you know, as the pandemic has encouraged us to change practice, is also another way of reducing footprint and can make it better for patients who don't need to travel, as well, as you all know. So it's about thinking about that system. But those are the resources that I would point people towards as a starting point.
Mm-hmm. Thanks. And I've been trying to have remote outpatients for years, and then got into trouble at the start of the pandemic for switching to, and then a week later they said, oh no, all remote. So that's something we've kept. And I think you're right. It's seeing people. It's what's right for people, and I think there's been some backing down.
Yeah. Yeah, it's, well, I mean, change is always difficult because we always like what we do, and yet we also, I think, you know, there is something about seizing all the good things that have also come out of the last 18 months, you know, the opportunity to change practice out of necessity, and, you know, making sure that goes forward in a constructive way and that really works for everybody.
Interesting. Thank you. And we've got another complication, of course, in respiratory. So as well as the carbon footprint to think about, and then the sort of the ethics of prescribing correctly for the patient, we have this double whammy now of the Phillips Morris problem of buying the Vectura inhalers, and then so people balancing their prescribing from the ethical and the carbon footprint perspective. It's a minefield, isn't it? Do you have any thoughts on that?
It is a minefield, and when I worked at the Department of Health all those years ago, the one, you know, I worked across things that impacted on people's health, including the food industry and others, but the one industry we did not talk to was the tobacco industry at all, for reasons everybody will understand. And it's very complex, and, you know, clearly They're trying to diversify their portfolio to stay alive as a business, which on that level you can understand, but there's a level of trust and I think, you know, natural skepticism around what their motives are. So yes, totally sympathetic to that. I guess it depends on how they use it in the long run.
Well, lots of food for thought. So Fiona, thank you so much for your time and all that experience and expertise, and I'm sure you will have people beating a path to your door to get involved in this. So we encourage everybody to try and think about their greener workplace as well as doing all their right on stuff at home. So thank you very much indeed, Fiona.
Yeah, great. And I noticed that in the chat there's a fantastic resource from Sussex that's just been put up for people to use as well, so I hope that's useful. But it's been great talking to you and thank you very much for the invite.